Good morning, everyone, and thanks very much for tuning in. You know, despite all of the work that's going on surrounding the pandemic, which is monumental, and for which I know my colleagues on the line are very grateful to everybody for doing, it's remarkable to me that we continue to see progress being made on some of the very large transformational files that we have going on. I'm pleased to be joined by a few of my colleagues today to bring you some updates about the transformation work that we are seeing some good progress on. That includes an update from Dr. Barry Lumb about our HIS renewal project. But we are going to start with Michele Beals, who is going to discuss some exciting advancements in our work to improve data, our capacity around data analytics, including the launch of the new Axiom platform happening today. So with that, I will pass it over to you, Michele.
Thanks, Rob. So I want to really start by sharing our planning and analytics transformation vision with everyone today. And that is to give access to the right data at the right time to make the right decisions for our patients and our health system. And there are three critical pillars to this work. And the first is related to the investment in new technology to enable our transformation. But this is more than just a technology project. There are really important elements that relate to our processes and our people. Firstly, I'm excited to announce today we've launched our CPM solution for budgeting and planning called Axiom. It is available to leaders through Dietrich and will be used to enhance our ability to plan, budget, and forecast and report. In addition to this, leaders can expect a rollout of My Insights reporting portal in Q4. This portal will help users interface to our Unified Data Architecture project, where leaders will be presented with intuitive and robust visualizations to support informed decision-making. Content will be populated by subject matter area and will replace legacy reports over the coming years. As with all technology solutions or introductions, this solution is only as effective as the process and teams that support it. To that end, we are actively redesigning the support model for planning analysis and decision support to provide greater organizational focus and expertise in three streams of work, that being supporting volume and service, labor and workforce, and non-labor. Next slide. As I mentioned earlier, I'm pleased to announce today the launch of our CPM tool, Axiom. This project has been in the works for nearly 2 years, and I'd like to congratulate the project team for their hard work in delivering this new suite of tools. Axiom is a planning and reporting solution that will replace our current budget tool and will support financial reporting currently obtained in the management information tool. This new solution was built for healthcare and is designed to help us evolve our planning methodologies to incorporate more patient and activity-based information. For fiscal 21-22, the budget cycle, it will be the same process, but we'll be using a new tool to complete this work. Axiom is a flexible tool that will allow planning approaches and methodologies to evolve in the coming years. Post 21-22, we will plan to shift to a new process with this new tool as we incorporate activity-based planning practices, moving away from our legacy envelope approach. Current financial reports and financial tools will be sunset over the next 6 months, and that would be budget tool and some of the financial reports you currently obtained in the MIT. Next slide. Key dates for Axiom. As I mentioned, the launch date today for the application in Dietrich. Over the coming months, we will run in parallel to build our reporting suite and budgets for 21-22. In April, we'll launch capital planning and tracking out of Axiom, and we will start to decommission legacy reports, processes, and applications like budget tools and Excel templates that have been used in the past to collect and consolidate information. In the coming years, we will use Axiom to evolve our planning processes, as I indicated, to incorporate more patient-centric and activity-based methodologies. What you need to do: Axiom training for leaders will be delivered through the LMS system, My Learning. And the training content will be delivered in bite-sized pieces along with distinct learning paths to facilitate specific training. So as of today, there's training available to help support login and access to Axiom. And the next week or so, you should see additional content that will help guide you through how you would view and drill into financial reports. If leaders require additional information, a post-go live support program has been established with a dedicated email address and financial advisors or ambassadors who can answer any of your questions. Resources will also continue to be available on the Hub and in future transformational webinars. As we discussed, or as I mentioned earlier, we are actively redesigning our support model for planning, analysis, and decision support to provide greater organizational focus and expertise in streams of work that support volume and service, labor and workforce, and non-labor. Programs will retain a single point of contact, helping them navigate the new and specialized services. Enterprise specialized teams will establish standard work in each domain and provide organizational-wide service. The goal is to shift to providing more proactive insight and support rather than reactive. Work will be coordinated with programs across teams via relationship advisors. And the analytics and business solution team is the technology team that will enable streams of our digital health plan solutions. That includes plan data science resources that will support specialized and advanced case uses in the future. When I think about the timelines for all of this work, the team configuration will be finalized within the next 4 weeks. And we will start to transition to the new support model in December, with the goal to have the transition fully completed by the beginning of April. The budget build for 21-22 will be, as I had indicated, the same process, meaning we're going to continue to leverage envelopes, the same people, we're just going to be using a new tool. So the current P&A and decision support staff that assist you every day in this work will continue to guide you through the budget build using our historical practices, but we will be leveraging a new tool. So with that, I'm going to be handing it back to Rob.
Okay, thanks very much, Michelle. So we will have a time for questions and answers facilitated by Aaron Levo at the end of this. But for now, let's turn it over to Barry Lumb, who has some words around progress we're making on HIS renewal.
Thanks, Rob. Hi, everybody. Back again. So the HIS project continues to move forward, and we've had some really terrific progress over the last few weeks. As you know, our plan is to move ahead with a single instance or separate instance, depending on what language you choose, of the Epic systems and software. As part of that work, we have been doing a whole series of readiness projects related to our ability and our preparedness to start working directly with Epic. And that includes work in the pharmacy and the medication management, ambulatory care specifically related to registration, scheduling, and referral handling, and very careful review of the hardware that's necessary to be able to move forward. And this are things like desktop computers, workstation on wheels, and all of the other pieces of equipment that you're going to need to be able to interface with the Epic system. You'll see when I get to the next slide that we've been really very successful in our hiring of analysts for the project. And as part of that, they have undergone very extensive onboarding already, which is bringing them up to speed on our systems and what the EPIC project will look like. And they're going to be reaching out as part of their initial work to various areas to look at current state assessment of where we're at and what will need to change as we go through the various work plans for the implementation. So I would encourage you, if you're asked to provide that kind of availability of your staff, that you find the time to re-engage them or to engage them. I can't emphasize enough how absolutely important it is, actually critical it is, that we set up ourselves to win and to succeed on this. And that means we have to get all of our processes in place before go live. We've been absolutely extremely fortunate to recruit Philomena Kensi as our new CNIO, and she has joined us. And we've also been very fortunate to acquire Carrie Cassell, who is our new project director. And Carrie is an extremely experienced individual in EPIC implementation. So Michele Lefleur, together with Carrie's skill in previous EPIC implementations, is absolutely fantastic. Next slide. Oh, sorry, don't change it, Patrice, my mistake. So I did want to formally also welcome all of the new folks who have joined our project team members and our analysts. We're looking to hire over 150 individuals at the end of the day, and we're well on our way. I would just welcome all of you. Keep informed via the hub, and as I said to you during your onboarding, we're here to help, and reach out to us at any point. And then the last piece, which I really can't tell you how absolutely delighted I am is to tell you, is that our board on Friday gave us the green light to proceed with the final pieces of the contract with EPIC. That has been a long and difficult process, both internally and working with our partners at St. Joe's and the Ministry of Health. I would expect that will be completed within days, and we are full steam ahead on our implementation with EPIC, including folks going to further training starting this week. So we are absolutely full out, green light, and going forward. And I hope that you'll see some words and an announcement soon about a formal project launch. And I think that's all for me, Rob, and I believe I'm giving it back to you.
Thanks very much, Barry. So we'll finish the presentations with a session with Tim Dietrich, who is going to be speaking about the work that we've got underway in connection with what we're calling the Strategic Performance Collaborative, and Tim can explain that. So Tim, over to you.
Thanks very much, Rob. I'm presenting today on behalf of Sharon Pearson. So thought I'd just give an update on where we are at with the Strategic Performance Collaboration. Many of you have already had a touch base with our GE healthcare partners. There's been over 100 interviews already completed. And so thanks to you, our leaders, for making yourselves available and sharing your insights to the GE team related to non-labor costs, patient flow, and our workforce and labor streams. On the quantitative side of their understanding our current state, data has been flowing to GE. And although the SPC work has really just got underway in the last couple of months, the data work has been happening for quite some time, and we'd be remiss not to say a special thanks to Paul Brown and the members of the business intelligence team, Alina, Jennifer, Rena, and Susan, along with Christina and our privacy team, to ensure that data could be shared with GE in a safe and appropriate manner. So thanks very much to those folks for making sure that work is happening. We had our first steering committee meeting on Friday. Our operating group leads have been assigned. Jennifer Cotis and Tiffany Rovlin leading the labor, workforce and labor stream. Sarah Jane Adams leading the non-labor stream, and patient capacity optimization being led by Deb Bedini and Kelly O'Halloran. We're actively working to assign position champions to the operating groups and look forward to that happening shortly. What's next? We have some GE Canada folks probably coming on site in the next week or two to do some observations of some of our processes. We don't yet know what that's going to look like. It may include things like rounds, could be bed management. We're working out the details of that over the next little while. So that's about all I have to share right now with the Strategic Performance Collaborative, and I'll now turn it over to Rob.
Thanks very much, Tim. And just to everybody on the teams who are advancing that work. I think, you know, it's great work, and it's amazing that you're doing it in the context of the very challenging atmosphere we're all working in. So good on you. I'm going to turn it over to a familiar face who has become the maestro in fielding questions. Aaron, you're going to take the session forward.
Yes, it was an undiscovered talent up until this pandemic that I could, you know, do this sort of thing. So, so to assist me in this role, I really appreciate if people could type their questions only using the question and answer function. But again, you could also raise your hand in the participants forum, and we'll call on you to ask a question live if that's your jam. We would love to hear from you, so please either raise your hand or type a question into the Q&A forum for any of our panelists, or I have an assembly of other leaders here available at our disposal to field any questions that you might have about Axiom, about the Strategic Performance Collaboration, or of course our HIS renewal. Not seeing any questions pop up too quickly.
Aaron?
Yeah.
I wonder if Michele Beals might give a brief explanation of the difference between activity-based budgeting and envelope-based budgeting.
I'm sure she'd be pleased to do that, Rob.
Yeah, nothing like putting me on the spot. So when we think about envelope approach, our traditional approach has always been around essentially carrying forward budgets that we've had previously that were all based on historical financials and didn't necessarily reflect or align to changes for volumes. And so as we move forward, the goal will be we'll be able to essentially relook at our financial distribution of the cash we have to support our operations to see how it aligns with those volumes. And when volumes change and shift, we'll also be able to better understand where we should be investing to support that new work.
Thanks for that, Michele. I do see a question here about our HIS renewal readiness. Barry, where do the inpatient areas fit into the renewal readiness program? How are they sharing insights? How are people directly represented in that process?
Thanks, Aaron. So what you're seeing is just the very, very tip of the iceberg in terms of the workflows and work project groups that will need to be put into place. So we're doing very specific targeted areas at this point, like pharmacy, like scheduling, but every area will be deeply involved with the project as we begin the implementation. And that really will only be a few weeks out. And we will have a inpatient work group, and that will have multiple subgroups. And then we'll be literally reaching out to every discipline as we go forward. So don't think that anybody's being left out. This is just sort of scratching at some areas that we know we need to have sorted out before we take out the shotgun and go crazy on every project.
Gotcha. Another question here coming in from our colleague, Susan Pucciarelli. Who should we contact to provide details about what our needs are in the future HIS for the behavior, safety, risk, assessment in terms of technical needs?
I have no idea, but I will be happy to connect with Susan and find out. Sorry, Susan, I
For
don't
sure.
know.
Okay, sounds good. You guys can have a virtual
Yeah,
coffee.
Susan, just email me and I'll get back to you.
Sounds good. I have a feeling that as we do get to our project go live and the work picks up pace, we're going to have a lot of opportunity to address some of the things like what Susan's raising in more detail for sure.
Yeah. Yeah.
Which is very exciting stuff. Okay, any other questions looking at our participants list? I don't see any hands raised. We'll give a moment for a last call for questions. Should anyone wish to raise them? Seeing none, as always, you can send any questions along that you have. Send them to the hhs@hhsnews.ca email, and we'll make sure to include that in future sessions or get you an answer right away. So before we close, I'll turn it back over to Rob in a moment to close things out. But before I do, I maybe might just put in a plug for LeaderSHIFT, which is occurring this month. Next up, we have equity, diversity, and inclusion this week. So there's 2 sessions. There's one tomorrow beginning at 11 a.m. and then there's another on Thursday. So we really strongly encourage you to enroll if your time permits, and encourage others other leaders to do the same. And all the details are available on the hub should you wish to find out more about the exciting speaker roster for this week. So Rob, with that, I'll turn it back over to you and to close this out.
Yeah, thanks very much, Aaron. And that's it for our agenda today. Thanks all for taking some time to tune in. I hope you do. You are able to get to a couple more, at least, of the LeaderSHIFT sessions. I've been able to get to each one of them so far. I think the speakers have been first class, and I'm sure the remainder will be equally impressive. So thanks all, and hope everybody has a great week. Cheers.